Hey, it's Dr. Jason Hall. It is 12:30 on the first Friday of the month, and so we're going to start doing this Facebook Live thing once a month to try and see if we can get some questions answered, talk to you a little bit about our practice and plastic surgery in general. And so this is kind of our inaugural live event. We've been soliciting questions from patients both on the internet and here in the office, and so I figure we'll just kind of go ahead and get started. It is kind of the end of breast augmentation season, and so I guess we'll start out with some breast augmentation questions. So the first one says, is there anything special about breast augmentation procedures you perform? And this is from Adrian in Nashville. And so I guess the question is, or the answer to that question shortly is yes, there is. There are a lot of ways to perform a breast augmentation that really help, I'm going to straighten the camera up here, really help and determine the recovery process. The breast augmentation gets a kind of a bad rap as being an easy operation or a simple operation. There's a lot of nuance to having a breast augmentation and making it look good. The breast augmentation procedure itself is typically performed by putting the implant under the muscle. And what I hear from a lot of patients around here who come and see me after having seen other people is that friends who have had surgeons elsewhere have a lot of pain, a lot of stiffness, can't move their arms for a short time after surgery, and it really shouldn't be that way. There was a lot of work that was done in the 90s and early 2000s by a group in Dallas led by John Tebbets, who really broke the breast augmentation surgery down piece by piece, step by step, and have been really preaching the tissue-based planning for breast augmentation. That is the procedure that I personally use in all of my round implants, and what women notice is that the need for narcotics after surgery is really minimal. Most women, if they're going to take narcotics, will take some the day of surgery, the night of surgery, and then really won't need any. They can raise their arms above their head immediately after surgery. Now, you can't work out after surgery, obviously. We want you to heal and not damage your chest or the implant while you're recovering, but it makes recovery a lot easier. What makes that special is really doing an augmentation with no trauma, no bleeding, no dissection by just pushing and making a space for the implant. Everything is done very slowly, very precisely, and that surgery can typically be done in between 30 minutes or an hour. The surgery itself, its speed is important because the quicker your surgery is, the less narcotic you get in the operating room, the less muscle paralytic you get in the operating room, which really cuts down on nausea and vomiting after surgery. So while speed isn't the primary goal, the faster we get you in and out of the operating room, the easier your recovery is going to be. So that's the big thing. In a typical round breast augmentation, now we've been using a lot more shaped implants recently. Those implants are typically placed over the muscle instead of under in my practice, but the same principles apply. There's a little bit more soreness, there's a little bit more swelling based on where those shaped implants are placed, but really atraumatic technique is the biggest difference. The next question comes from Sandra And she says, I think I need a facelift, but don't want to go under the knife. What other options are there? And we got a similar question, I think, last time in our live event, which was back in March or something like that. There are lots of things that we can do. Fillers have gotten very good and are really the mainstay now in younger patients in preventing the need for facelift surgery in your 40s and 50s by being able to restore volume and keep some of the lines and wrinkles that we're trying to eliminate with a facelift from showing up. The other thing, which is I can't overemphasize the importance of, is skincare, especially in East Tennessee, where as soon as May rolls around, people are out on the lakes from May to almost October. Really taking care of your skin and avoiding a lot of sun damage is of primary importance. Things to do there, you're looking at using a good sunscreen, so a zinc-based sunscreen with an SPF of at least 40 or 50, and then using a topical vitamin A or a retinol. Those are probably the two highest yield things. Then we can kind of get into all the rest of that skincare topics a little bit later, but that can be really a whole show in and of itself. And then along with skincare, we can talk about laser resurfacing or laser skin tightening, and there's a lot of different avenues we can go down there. But treating the deep surface of the skin with volume, fillers, and then treating the top of the skin with both topical skincare you do at home and things we do here in the office. The lasers, chemical peels are really the ways to avoid needing a facelift until you're much further down the line. Okay, let's see what we have next. Here's another one about breast augmentations. So I see that you use Vectra 3D imaging for your breast augmentation consults. Is it accurate? And will I look like the imaging system says I will? Yes and no. I was initially really excited about the Vectra when we bought it. I still think it's a great teaching tool. It's a great consultation tool. Is it accurate? It is accurate. As accurate as we can be beforehand. I jokingly tell people when they're here that the computer is too stupid to do certain things. Simulating a breast lift is one of those. The software is just not good enough to be able to simulate all of the complicated tissue movements that happen with a breast lift, especially when you join that with a augmentation. But for primary augmentations, I think that the Vectra is fairly accurate. And one of the things that we'll do here in the future is start posting before and after photos with the Vectra pre-op simulation so that you can kind of see what we thought it was going to look like and what it looks like once things are healed. So I guess the short answer to your question is yes, sort of. Let's see. Here's another augmentation question. How long do I have to wait to exercise after my breast augmentation? What about wearing bras, underwire, push-up, or strapless bras? This is from Lisa. This is probably, of all of the things that we have to deal with after breast augmentation from a patient perspective, this is the hardest one to convince people to stick with, because most of my younger patients, and even some of the patients who were doing not only an augmentation but a lift in conjunction with that, feel good enough to get back to exercise after a week or two. We recommend that you take about 6 weeks off before getting back to an exercise plan to let the implants settle and your body heal so we don't start displacing implants shortly after surgery. But if they're done right, you don't hurt after a breast augmentation. You can move your arms, you're not stiff, And so most women feel like getting back to the gym after a week or two. And so, it's really a challenge for us to keep you as a patient from getting back to exercise too early. In terms of bras, we recommend against wearing an underwire for that same amount of time, just to let the implants heal. We don't want a wire that's too tight or too high to start displacing an implant in the early healing process. When the scar capsule that forms around that implant is forming, because that usually requires surgery to correct if the scar capsule is formed in an incorrect location. In terms of push-ups and strapless bras and things like that, they kind of all fall into that same category. You need to wear a supportive bra after a breast augmentation surgery, but one that doesn't have a wire or isn't trying to push your breasts into an unnatural position. You want to let that heal before we start pushing them in different directions. Let's see. Here's a question about lasers and acne scars. I want to remove my acne scars, and there's a lot of lasers out there. Which ones do you recommend? And this is we got something very similar last time as well. There are a lot of different lasers out there, and people have tried. Acne scars can be very problematic. I guess I'll start by saying the one thing that I will recommend against in treating acne scars is simply excising them. Technology has come to a point where we have lots of different things that we can do, and removing an acne scar, especially if you don't end up putting stitches in the place that you removed the scar from, is just going to make matters worse. I have seen quite a few patients who have had acne scars which have been surgically removed or cut out with a punch biopsy. And while I don't have the benefit of having seen them beforehand, the results look like a bad acne scar. And so we do not excise acne scars as a general rule. In terms of the best way to treat those, a lot of fillers actually have been very helpful in eliminating or significantly minimizing the appearance of acne scars by being able to add some volume underneath that scar and help them not be so deep. The reason that acne scars are so problematic from a cosmetic standpoint is that they cast a shadow in the depths of that scar, and if we can lift the base of the scar up, the shadow's not so bad and the scar's not as noticeable. Combining that with a topical laser treatment or even microneedling, where the top of the skin is, for lack of a better analogy, sanded down and smoothed out, really improves the look of acne scars. And we have a couple of photos that are going up on the website soon of some combination treatments like that, of acne scars that have been treated with either radio wave surgery, laser, combined with fillers, and the results are fairly dramatic. Then here's I guess this is our last question. We kind of ran short on questions today. What's the difference between Botox, Juvederm, and Kybella? It's a good question because there is a lot of confusion about those. They're all injectables that are all used to combat the aging process, and it can get confusing. So Botox is a neurotoxin. So it is a chemical that actually paralyzes muscles. And that sounds kind of scary, but in the low doses that we use for cosmetic injections, what that does is paralyzes muscles of the face. So, the muscles in your eyebrows, let you do that. Raise your eyebrows, and then when you smile, you get these crow's feet here. Those are all wrinkles that are created because of muscle movement. And Botox treats those wrinkles by actually paralyzing the muscles that do that and keeping those wrinkles from forming. So there are also a lot of uses. We can do a lot with Botox in the lower face that really doesn't have as much to do with wrinkles, such as fixing a gummy smile. If you can see your upper gums when you smile, that can be treated with Botox. And before that, the only thing to do was jaw surgery, which very few people really want. And we can also, turn up the corners of the mouth, fix dimpling in the chin. There are lots of things that we can do with Botox in those low doses. Juvederm also works to eliminate wrinkles, but it works differently. It's a filler, so it fills in the lines. You can think about just, kind of filling in anything. You've got a crease. You inject that filler underneath it. It flattens the crease out by lifting up the skin. And then Kybella is kind of a new one that really doesn't work on wrinkles as much as it works on fat. This is you can think of it as kind of a liquid fat dissolver, which on the outset kind of sounds cool, but because of what it does, its uses, at least in our practice, are fairly limited. The FDA has cleared it to eliminate this fat here under the chin, this kind of double chin fat. And it works pretty well for small areas. I have to say, though, kind of seeing the results firsthand and comparing those to the same results that I can get with a small amount of liposuction under local anesthesia here in the office that takes about 20 minutes, I would recommend liposuction almost every day for patients. The cost is less, the recovery time is certainly less, and it just is a much more pleasant overall experience for patients versus Kybella, where you're swollen and look like a bullfrog for a couple of weeks, then your skin is numb, and we are limited as to how much we can use at one time, so you oftentimes will have to come back for 2, maybe 3 treatments. That said, Kybella is very useful in this little bra fat here, in little areas of the stomach, if there's just a tiny area that needs to be touched up. We've used it to correct secondary liposuction deformities. You've got a little bulge after liposuction somewhere. Kybella is great to get rid of those areas. So it has a utility. We just haven't been using it as much because we have better tools in the tool shed, certainly for this area here. There's another question we got just now coming in. Are you able to fix a belly button after having children without having a major surgery? And the answer to that is yes. Just fixing a belly button, turning, and I'm assuming that we're talking about turning an outie into an innie, is one of those things that we can do under local anesthesia in the office without really having to go to the operating room at all. It really depends on what the cause of the belly button deformity is. If there's a little hernia there, oftentimes after pregnancies, those hernias are fairly small and can be fixed in the office. Larger hernias obviously will need a little bit more extensive repair, and those are done in the operating room. See a lot of belly button hernias that we end up just fixing coincidentally during tummy tucks after women have finished having children and we're doing a tummy tuck. The belly button often gets a makeover at the same time. So, so the answer to that question is yes, you can fix a belly button after having kids without having a big operation. Well, good. Well, thank everybody for joining me. We have kind of run to the end of our time. We have patients here in the office to take care of. So thank you for joining. We'll do this next month, first Friday. at 12:30 Eastern Time, so everybody on the East Coast can join us during your lunch break. And if you're on the West Coast, you can sneak off and take a coffee break and join us then. So thanks, everybody. Have a good weekend. We'll see you next month.